Hello, my name is Scott Richardson and I'm a doctor of acupuncture. Now, I hear a lot of people having confusion about a new type of therapy, something called dry needling. It's something that a lot of times is being performed by a physical therapist or maybe a chiropractor. They don't know how that is different than acupuncture, and there seems to be a lot of confusion about it. So I want to take a second and explain what acupuncture is, what dry needling is, where they're similar and where they may be different. First of all, I always like to recognize my bias. I recognize that I am explaining this from a standpoint as a licensed acupuncturist. To give you an idea of my background, I have 4 years of graduate training in acupuncture. I have an additional 2 years of postgraduate training. I have over 2,000 hours of didactic classroom hours in needling therapy, as well as over 1,000 hours of supervised clinical hours in needling therapy. I've studied acupuncture, dry needling, injection therapy, and so it's something that I feel like I have a pretty good grasp on. Now, there is a lot of debate on what dry needling is and if it actually is acupuncture. So I want to take a second to explain where they are similar. And these are things that really aren't debated. It is whether you're coming from the side of a physical therapist, chiropractor, or an acupuncture, these are areas where everybody agrees on. First, the instrument that's being used. They are referenced by the FDA as an acupuncture needle. They can also be called a solid filiform needle, or but they are all regulated by the FDA as acupuncture needles. Whether you're having dry needling, whether you're having acupuncture, they're using that same type of instrument. Now, needles can vary both in length as well as gauge or thickness. We are finding that it is not uncommon for people doing dry needling to use a thicker gauge so that it can seem like there is a different sensation. But again, it is the exact same tool whether you're going to your physical therapist or whether you're going to your acupuncturist. The locations. This is something that is, again, debated quite a bit, but the clinical research, the studies are showing that there is anywhere between a 75% to a 95% correlation, similar locations being used between the two practitioners. In fact, because of how high of a degree of similarity in the location, a lot of people are starting to think that many of the traditional acupuncture points were diagrammed on the body because they are common places for trigger points. But again, same tool, same location, they're used in the same way. Again, the needles are being used to puncture the skin in order to stimulate the underlying tissues. One of the areas of debate is how deep the two different therapies go. For some reason, people think that acupuncture only stimulates the surface of the skin or does not go past the skin itself. And that simply is not true. If there's any questions about that, all you need to do is grab an acupuncture textbook and look at the depth of the different locations. It describes specifically the angle of insertion as well as the depth of insertion for every acupuncture point. It is not uncommon over areas where there is lots of muscle. For example, going to the hip to relieve piriformis syndrome or to stimulate that glute muscle. It's not uncommon that acupuncturists will go several inches in order to stimulate those underlying structures. That is something that is taught in our schools. So again, recap, same tool, same locations, same depth. Now, people will say that they will have different experiences, and this is something where a lot of the debate focuses on. Traditional language versus modern language, and then what the patient actually feels. First of all, again, whether you're a licensed acupuncturist or a physical therapist, the patient's body is not going to respond differently because of who you are. The patient's body is going to respond the same if you're an acupuncturist needling in that location as a PT needling in that location. Some people will notice that the treatments feel different, and that is because A, they're probably using a different gauge needle, and then B, there are many different types of acupuncture. I am an acupuncturist that specializes in orthopedic or sports medicine. It's not uncommon that someone will come from a practitioner that's trained in Japanese acupuncture or 5-element theory, and they'll come to me and say that's a completely different treatment than what I received from a different acupuncturist. Again, that's not unique to the profession of acupuncture. You can go to 2 different chiropractors and get different style of treatments. You can go to 2 different physical therapists and receive different therapies. But again, the patient perception of the treatment is just because of the style of needling that is being used. If you talk to most acupuncturists, they will say that dry needling is just a technique of acupuncture. We study many different types of techniques. Physical therapists will claim that because they're using modern locations or modern language, that means that it is a different procedure. The language being used does not change the procedure itself. So if I'm using Latin to describe what I'm doing versus using English to describe what I'm doing versus Chinese, that doesn't change the procedure itself. You're just using a different idea or a different method to explain what it is that you're doing. One thing that I will say that generally will vary between dry needling and acupuncture is the length of the treatment. Traditional acupuncture treatments, the needles are placed in the body, you rest for about 25-30 minutes, then they're withdrawn, and then you can do other things like cupping or added modalities. Dry needling is a specific technique where you're going in, you're trying to elicit a local twitch response. You're trying to get that muscle to contract, to quickly, they call it a fasciculation, but to twitch, to release and let go, and then you're immediately removing the needle, and so the treatment does not last as long. That is not unique to Western medical practitioners. They do the same thing in China, they just call it by a different name. It's something that's been within the literature in China since around 600 AD. But again, it's something that is definitely within the literature. So that is something that if you're scheduling an appointment, you'll see a difference. Traditional acupuncture, plan on about an hour. Dry needling treatments, plan on 15 to 20 minutes. But again, as a recap, the 2 therapies are very much similar. The tools used are the same, the locations are the same. One thing again that I will point out, the training required to perform the procedures is vastly different. Again, myself, I have over 2,000 hours specifically in needling therapy. That's not counting my training in anatomy and physiology, pharmacology, all my ethics and other classes that are required. That is specifically in needling therapies. For physical therapists or chiropractors that want to do dry needling, it is a weekend course. It is 1% of the training that I have personally, and less than 10% of the training that most acupuncturists have in how to needle the body effectively. So I would say anytime that you're going for any type of needling therapy, ask your provider, what is your training specifically in this technique? If they're talking about hours versus years, then I would say that is a red flag. You can get good results from both. I know people that have gone to a physical therapist and they have great results with their dry needling. I have some that have also been injured. So again, I would say do your homework, find out how much training your provider has, and then make a decision on what's best for you. If you have any other questions, feel free to email me. I'm happy to talk more about this. But again, thank you for your time and have a great day.